Well, good morning and welcome to today's legislative listening session. Since this is a Zoom meeting, we ask that you keep yourselves muted until it's your turn on the agenda to speak, or to raise your hand if you have a question or would like to speak. If you've dialed in using your phone, you can press *9 to raise your hand. If you are using your phone audio, please send us a message using the chat feature to tell us your phone number so we know which number is yours. We encourage questions if you have them. You can type them into the chat box and we can address them there if you're preferring not to speak. This meeting is also being recorded and a link will be provided after. Thank you again for joining us today. Now I'd like to welcome Melanie.
Hi, good morning, everybody, and thank you very much for joining us this morning. We are doing 8 of these legislative briefings about COVID-19 and what the counties have been facing and what they anticipate facing in the future. We've set them up by region, and you are Region 1, which is Island, San Juan, Skagit, Snohomish, and Whatcom counties. We did it by geographic location, so not everything works out perfectly for legislative district, but you are more than welcome to join any of the 8 webinars that we will be doing. We are holding them this week and next week, so we're cramming them all into a short period of time. At the end, we will synthesize all of the information that we've gathered through all 8 and put together a product where we can share with you the high-level responses that we heard on the phone today and the next 7 days. And you will also, like Mitch said, get a copy of this video and the notes specific to this video as soon as we can get it all put together. You are the first of our 8, so I appreciate you being our guinea pigs. We're all learning, and so hopefully this will go off with as few hitches as possible. We are going to start with 20 minutes for an overview from some local public health officials on what the area has faced and what they are doing. And then we will move on to 25 minutes for the impact on county functions. And we'll have 5 minutes per county to talk about maybe unique things or strategies that they've put in place, things like that. Then we will move on to 25 minutes on looking ahead, again, 5 minutes per county. And then we will leave the remainder of the time for questions that any of you have. You are welcome to type questions into the chat box. You also, as Mitch said, if you're on the phone, I think you need to press *9 to unmute yourself and to raise your hand if you're on the computer. And we will we'll take all of the questions at the end. So that way we're making sure we're allowing enough time for each of the counties to speak. As we go through the slideshow, you'll see there's a number of slides that we're not really addressing. They're informational for the most part and are there for you when you get a copy of the slide deck and can look at them more at your leisure. So don't feel like you're missing something when we skip over them to move quickly ahead. You'll see that we have the names of the county officials from each county, as well as the main address and phone number for the boards of county commissioners and county councils and executives. And then we also just have some bullet points that are examples from some of the counties that they sent in. We don't necessarily have to talk about those examples. We can if we want to, but they're just there as ideas for you to take a look at, again, like I said, at your leisure. So with that, I am going to turn the microphone, so to speak, over to Jamie Bodden. She is the Managing Director of the Washington State Association of Local Public Health Officials. She has been extremely busy coordinating everything over the last few weeks, and I will let her introduce our public health speakers and we'll take it from there. Thanks, Jamie.
Thanks, Melanie. And Mitch, if you would be willing to advance the slides a little bit to our public health slides, that would be great. Like Melanie said, we have been very busy in the world of public health. Feel free to keep going, Mitch. In response, and it is my pleasure to introduce two of our local leaders who have really been at the front lines of this pandemic in Washington State since the very beginning. Sean Frederick is the administrator for the Snohomish Health District, and then Mark Tompkins is also joining us from the San Juan County and Health and Community Services to provide some local perspective and updates on what is going on in the region in terms of their COVID response. And so with that, Sean, I will hand it over to you.
Okay. Good morning, everybody. As Jamie said, my name is Sean Frederick. I'm the Administrative Officer for Snohomish Health District. As you all know, Snohomish County had the first confirmed COVID case in the country. So it has been a really steep learning curve throughout Snohomish County as we implemented some of our plans that existed around emerging infectious diseases, and worked with our local partners to engage with that first case to make sure that they were transported and cared for in a proper manner. Obviously, since then, we are several thousand cases into the response here locally, and over 20,000, or I believe around 14,000 cases into the state response. A lot of what's happened here is around coordinating. This has obviously grown well beyond the borders of public health and has many cascading consequences and impacts. So a lot of what we've been doing is working with our local partners, local government partners, with Snohomish County government, working in conjunction and unified command with Snohomish County Department of Emergency Management, working with Department of Information Technology to make sure systems that we're able to take advantage of technology to work remotely, with our own internal mitigation processes, working with the healthcare system, trying to facilitate requests for PPE, doing direct interventions such as drive-through testing. We've now transitioned away from our drive-through testing sites. We saw approximately 2,300 individuals come through our drive-through testing over a 4-week period. We've transitioned into surveillance testing in our long-term care facilities. So we've been for about a week now going into our long-term care facilities and testing all of the residents and staff in those facilities. We're looking for abilities to expand through our partnerships locally, our capacity to test. And more importantly, as we start to look at how do we begin to meet some of those guidelines that we know will be necessary for us to roll back some of these mitigation steps, how do we increase our capacity to do the case investigations and contact tracing, along with the increased capacity for testing that'll really be needed to have a good surveillance system in place as we roll things back to make sure that we don't inadvertently create a second surge of patients as we get back to normal. Obviously, that creates challenges across the entire public health system, not just here in Snohomish County, but in terms of resources, staffing, technical skill to be able to do some of those higher function events like the case investigations. It's a very detailed process and requires a bit of training and experience to be done well. So really, those are kind of the bigger pieces. We've had a great collaboration with Snohomish County government here, specifically around isolation and quarantine. We currently have a 150-bed isolation and quarantine site that's been stood up and working quite well thanks to leadership from Snohomish County. Um, that's kind of where we are.
Great, thanks, Sean. Mark, I haven't seen you on the participant list, so if you are, if you can unmute yourself and say hello. Otherwise,
Yeah, Jamie, I'm
thanks.
here.
Great, thanks, Mark.
Yes,
Go ahead.
yeah. So, like Sean, I would just say that local public health has been responding to COVID since really January, maybe even a little bit before then. And so we're a small, rural, geographically isolated community, and our staff have been working since January on COVID. And so this is not something that we've just stood up in the last month and a half. This is something that we've been working on for quite some time. And it started out as I think Sean has said initially, just dusting off some old plans, updating our partners, updating our healthcare system. We were still learning a lot about the illness. And so there was a lot that we didn't know, but it was just getting our partners, our healthcare providers, our schools, and others up to date on it. We were, even as a small jurisdiction, our community travels quite a bit. And so we're monitoring travelers pretty quickly. And so we had multiple travelers that we were doing the symptom monitoring on, and that was part of it, and messaging that out to the community. Really in March, we ramped it up, and as a small jurisdiction, we co-opened our EOC together with our emergency management folks, which I think was vital for us, and started, this was early March, right after the first community acquired case and then death here in the state, and focused a lot on messaging and working with our partner organizations. And so we've done a lot of messaging when it came to working with our grocery stores, our food banks, our various community organizations, not just schools, but camps, the island rec, different island rec programs. And so a whole bunch of messaging around and working with individuals who had lots of questions on their programs, and that continues to this day, and has been an important piece, whether it's with our schools or other business owners. And so we've had well, 160 to 180 businesses or contacts with our local businesses for a small community. It's been quite impressive. And then, as Sean said, a lot of efforts around the case and contact investigation and tracing, and really trying to identify folks early. As a small jurisdiction, we've been fortunate that we're able to contact all of our medical providers. We've been contacting them daily, finding out who they've tested. And then we follow up and ensure those people we're isolating. And not all jurisdictions could do that, but we were able to, and with our county council and administration allow us to bring in temporary employees, former public health nurses. We were able to do that immediately and get people isolated immediately, getting close contacts quarantined. And we've been fortunate to keep our case count down to about 13. And this is a community that travels a lot, whether it was for business reasons and or off to the mainland for shopping and medical and other needs. And so for us to keep it at 13 and with no deaths has been remarkable. And I really go back to that aggressive case and contact tracing and being able to do it locally, which was extremely important, and have the local contacts with our medical community and be able to do that has been really important. We're not quite as far along on the isolation quarantine as Sean talked about, but we're working through that. We have with islands are trying to identify isolation quarantine facilities throughout our county. So we're not shipping people around on ferries. And that's been a little bit of a struggle for us, but we're working through all of that. And we are in the midst of and working with trying to figure out how do we reopen. And You know, we're a tourist-based economy in some respects, and you know, our health officer did an order right away limiting transient accommodations to essential personnel only, closing playgrounds and targeting our marine transport facilities, and having put signage up saying that it was for essential travel only. And so we're looking at that and what that means for our economy. And so that's what we've been doing. And again, it's been I would say a joint DEM, public health, and community effort. We brought in community volunteers to staff our EOC and positions. And so it's really been a community-wide, county-wide effort to address the needs. And I guess I can't stress that enough, is that we've had great community partners who have stepped up and done some amazing things. We've had great leadership from our council, and allowing us to stand up our EOC and bring in temporary employees to make things happen. And so, you know, I think that we've responded as a community in significant ways. A lot of it's been on our relationships that we've built over time, and we continue to work in a region. Sean and I and the other directors regularly communicate and figure out how we can work together to not only address COVID, but how do we work together in all aspects of public health. And so with that, I'll turn it back over to you, Jamie.
Great, thanks, Mark. Much appreciated. Just kind of two kind of closing questions for both of you as we kind of move through for the rest of our webinar. Looking ahead, what are some of the biggest things that you're addressing or working to address kind of as we're moving towards a lot of these discussions around either reopening or dial back? What are some of the challenges you anticipate, or things that you're going to continue working on, or big items that you're really looking for as kind of we move through this next phase of response? And perhaps, Sean, you could speak first, and then we'll let Mark speak.
Thank you. I hit the wrong button there. I think some of the biggest challenges moving forward are really some of the biggest ongoing conversations, not just locally or even regionally, but at the state level, is how does the public health system on a state level get to the point that we have the capacity for the case investigations and contact tracing that'll be needed with the increased levels of testing that are required based on the scientific literature for us to be able to start to roll back some of the mitigation steps. So those are kind of some of the big things. What goes along with that conversation is the need for adequate capacity and availability of PPE, but also isolation and quarantine as we see increased numbers of positive cases because of increased testing. It'll likely drive the need for space for that isolation and quarantine. I kind of look at it as once we begin to move back from some of these mitigation steps, it kind of requires us to move back towards this increased containment effort, which is really focused on the contact tracing, the contact investigations, in that body of work. So I think those are kind of the big things that are kind of being weighed out and discussed locally, regionally, and at the state level.
Yeah, I'll just echo what Sean was saying. I think that we need to look as a system, whether it's at the local level, regional level, or statewide, at the workforce, and how we can maintain some of these systems going forward. Again, as a small jurisdiction, we've pulled in staff from multiple county departments, and again, being allowed to do that has allowed us to be effective in our response. But as we go back to some sort of normalcy, staff are going to have to get back and, go back to the auditor's office or go back to Public Works and start doing their day jobs. And so how do we continue to do the messaging with whether it's to our community or to our partner organizations? How do we maintain our staffing to do that case investigation and contact tracing? If we end up having people in isolation and quarantine and having facilities, how right now we're relying on some local nonprofits to help us with that. As we get back to normal, what does that look like? And I think it gets back to the staffing question and how do we pay for it? And so, we've been fortunate in that we've had good support from our fellow county departments, but as we move forward and people have to get back to their day-to-day jobs, it's going to be more of a challenge for us, and we are looking at that and what we need. And again, I think for us, we found it being very effective to have that case investigation and contact tracing at the local level. And we have the relationships with our medical providers. It's just how do we maintain staffing and how do we pay for it? Because again, we brought in temporary retired public health nurses, or we pulled in our environmental health staff. And at some point, the permitting is going to have to get done, food inspections, and so all of that plays into it. And so I think that's going to be a key piece is the workforce and having those systems in place so that we can safely reopen and provide for the safety of our community as we start opening up the economy.
Great. Thank you, Sean, and thank you, Mark. Very much appreciated. As an association that represents you, I am so proud of the work that you guys are doing, and I know it's been a really challenging time. I know you and your staff are putting in a lot of really long weeks, and in some respects, folks, haven't had a day off in months, literally, and I really, really do appreciate it. I'm hoping you'll be able to stay with us as we do have a few questions that have trickled in that we might be able to get to at the end of the presentation. And with that, let's move the slide forward one more time, and I will turn it back over to Melanie.
Thanks, Jamie, and thank all of you from Public Health for taking the time out of your incredibly busy schedules to be here today, and for everything that you've been doing. I don't know if you get thanked enough. If you get thanked constantly, it's probably not enough. We now have about 25 minutes, 5 minutes per county. I apologize, my dog is here in the background, so the weird noises are my dog. Let's start with Snohomish County, and we have, hopefully the executive is here with us, and he'll spend a few minutes talking about how reacting to the COVID-19 pandemic has affected Snohomish County. And then we'll move on to the next one, Whatcom, and we'll just keep going down the list.
Sure, I'm here, Dave Summers, Snohomish County Executive, and I'll give just a high level explanation of what's been happening here. But we partially activated our emergency management system when the first case was identified in Snohomish County. So we've been activated for quite some time, fully activated since March. And what that's allowed us to do is bring in county departments, sheriff's office, health district, city of Everett, and others that we provide emergency management functions for, and really early on organized to make sure everybody was really understanding their role and given clear direction on who was doing what, so we didn't get crosswise, and I feel that's worked really well. At county government early on, we also went to mostly remote operations, so we've got most of our staff working from home, but have actually been able to maintain most of our functions and departments in an active state. We're still processing building permits, and we had an election in the middle of this, and we've got filings coming up next week, so we're making plans for that. But we have been able to maintain most of our functions. Of course, the courts are pretty much shut down at the current time, although there's some video court action going on also. We, early on, there was a problem with food supply when the public really kind of made a run on our grocery stores. So I early on issued an order that eliminated any ordinances within the county and our cities that restricted delivery times, for example. We had several cities that did not allow food truck deliveries during certain hours. And so we tried to clear the way to make sure that any impediments to food supply and food delivery were taken away very early. We also had to start planning, as Sean's already mentioned, for a quarantine site. We do have the large site at Angel of the Winds, 150 beds. We're now looking at how we transition away from that. But in parallel with that, we also have a program where we've issued actually several hundred housing vouchers. So we've got homeless folks that would normally be in shelters. Sheltering together is not really meet the social distancing requirements. So we've got them in vouchers in motels around the county. I would say closing parks was important. When the weather was nice early on, we were getting hordes of people at our parks. So we closed parking areas and public facilities, although we are messaging people that being outside and socially distancing is probably a healthy thing. So we're not taking a really hard line on park closures, but trying to discourage. One of the big functions we've had to do is really coordinate the request for PPEs for our medical system and for first responders and departments, and that remains a challenge. PPEs, testing kits, etc. So we're in constant communication with the governor's office, the State Department of Health, and the state emergency management system to coordinate these things. And there's been some hits and misses there in general, though I think it's worked pretty well. We've had a little confusion at times on who is doing what, but I think we've managed to sort that pretty well. We're really now getting into discussions about recovery, and that might be getting onto your next slide, so I'll hold off on that, but we're looking at the next phase of this and how we can start to open things up a little bit. So maybe let me see if I caught everything. I think I'll leave it there for now and come back if we have another little discussion about challenges we're facing now.
Thank you, Executive Summers. Really appreciate it, and all the work that your county and community have done and faced up there. Let's move on now to Whatcom County, and we have some commissioners as well as the executive on the line. He is apparently having audio issues, so if we could have the the council members jump in and pinch hit, would really appreciate it. Hopefully we'll get the audio figured out in the meantime.
So hi, this is Red Brown. Can you hear me? Yes.
Yes, thank you.
Yeah, I want to be careful not to overlap with what Executive Sadhu is going to do. But I just want to throw a couple of comments out. One is it'd be useful if at the WASAC level we could start looking at issues where strategizing amongst the counties on how we could save money. We're going to obviously have declining revenues. And we're going to have the two focuses for me is how do we reduce our expenses and how do we protect our cash flow. One sort of off the cuff thing on expenses is the value of the price of a barrel of oil went to negative $40 a couple of days ago. They'll pay you $40 to take it. We were just about to release a contract for chip seal work at the old price. Now that would have resulted in a windfall to the provider of probably, best guess $200,000 or $300,000. So I think that's a contract that needs to be rebid, for example. And then the other side of it is I'd also like to have a discussion about how do we deal with things like backlogs, like the court system. a public defender's office has already indicated that they want additional resources to deal with the backlog. Every department is going to be looking for resources to deal with overtime to catch up. So I'd just like to have a bit of a strategy session at some point on that. With that, I'll finish.
Thank you, council member. Do we have any other council members on the line who would like to speak up?
This is Todd Donovan. I was hoping Sat Paul's audio would come in, so just like Mr. Brown, I don't want to step on his toes, but a couple of things.
We can come back to him when we get it set up, but please go ahead in the meantime.
Yeah, a couple quick things. I mean, we are opening a isolation quarantine facility that's sort of rolling out slowly. I think I heard Executive Summers saying that they were doing a similar thing, but hopefully get Sat Paul back. I just want to throw out one thing, since we have several state legislators on here. We've been taking a hard look at our budget, and as Rudd said, there are going to be these cash flow issues. But we're in one of these smaller jurisdictions that does not necessarily look like it's going to get direct money from the federal government. Those are going to larger cities and counties, and if the state legislators can just be made aware of the need that local governments are going to have for some assistance as we're going forward, I want to draw attention to that. I mean, that was a big part of the stimulus package during the Great Recession, and helping local governments, either getting the money through the states or directly to local governments. And we're not seeing that or really yet, except for maybe some FEMA reimbursement. So I just like to draw attention to that. Thanks.
Excuse me. Thank you, council member. Do we have anyone else from Whatcom County on? We will come back to the executive once we get that figured out, but we can move on to Island County if we don't have anyone else from Whatcom.
So this is Commissioner St. Clair. We had conflicting meetings, so Commissioner Johnson and Commissioner Price Johnson are in another meeting where they needed quorum. I believe our Treasurer Wanda Groen is also on the line, and I'm just going to go through sort of an overview of what's experienced in Island County and then what some of our kind of legislative priorities may be going forward. Our initial response, we began to set up our EOC in mid-February when we first started to hear of this. As I think Snohomish did, that we began a partial setup. We declared a state of emergency on March 2nd and began sort of fully launching our functional call center, our emergency response. What we learned is our COOP plan and our emergency planning was very finely tuned for an earthquake or other disaster, but not necessarily for a pandemic. We've structured our emergency response into 2 lines of command with the mission manager that oversees both. So we have a aligned public health response that is addressing all of those issues, and then our emergency response for logistics such as PPE, testing, coordination with our hospital, with our Navy base, and all of those other things. And I think that structure is going to really serve us well as we move and begin to pivot from response to recovery, and as we carefully monitor what's going to happen as we come out of the first wave of restrictions and begin to ease those, anticipation of second wave. I want to talk a little bit about what I heard from my constituents, what their big concerns were. Lots of emails at the beginning of this, what's the response of Island County? And a lot of what was highlighted for me and goes to the importance of our legislators in the room is the role and the importance of foundational public health and the importance of crisis communication. Without, and just as a reminder that Washington State's one of the states in which we can definitely use additional investments in public health, that became extraordinarily clear that they are critical to the health and safety of our communities. Folks calling about how do I protect myself, understanding symptoms, testing, how are you protecting us, what's the data and response, who is sick and where, what's our contact tracing plans, quarantine questions, what's our healthcare system capacity. We have a rural health hospital that, our hospitals are often threatened with economic challenges, and really we appreciated the efforts of the state and our community to step up and support Whidbey Health to make sure they can continue to work throughout this. And then we got lots of citizens offering advice on how we can do better, as most of us probably did. We got lots of questions then as it moved on as to what can you do for me. Big one was trying to access unemployment. Appreciate the efforts of Commissioner Levine to bring ESD, revise the portal, get it upline, add staffing. That's been a significant challenge for my community. Some folks 6 weeks out and getting their financial resources. So appreciate the effort there. We need to continue to refine and work and help our local folks connect to those. A lot of questions regarding Help My Small Business. There was confusion about the different resources on the state and federal level available and challenging navigating that. Am I a sole proprietor? Do I have employees as a sole proprietor? So lots of questions, especially for those who aren't typical consumers of government services. Lots of questions about access to resources, basic needs, rental assistance, utilities, mortgage assistance. Help me understand where I can get help. Lots of questions about what are you going to do about property tax. I want to give a shout out to our treasurer. Island County did not defer property taxes, in part in response to the critical needs of our hospital and our fire and rescue. Our junior taxing districts did a strong plea to not defer that and put that additional financial burden on them. So our treasurer did above and beyond in working out and setting up payment plans with those in need and helping those who can qualify for exemptions. So sort of case by case responding to those who needed assistance without putting at risk our other systems of care and response. Lots of questions about understanding the governor's orders, essential business, what should be open, what should not, and the need to support local small businesses. I can't say strongly enough how our local community volunteers and nonprofits and chambers stepped into this crisis with government, delivering food to seniors, creating drive-by food banks, Meals on Wheel delivery. Our school district and food bank partnered to get schools food out to families. Our school backpack program jumped from 370 to over 1,000. I was very impressed with the work in our homeless community and the executive director of our homeless coalition in helping without even before we started getting strong public guidance, creating social distancing in our shelters, helping to create some protective measures there. So we've not had any cases in our homeless population as of yet. And then our chambers of commerce in connecting local businesses and banks to the services they need. Where we are today, we are working to continue to monitor data, watching for clusters, worry, as others have mentioned, about the second wave, need for strong regional data. I really appreciated the State Department of Health's new website where you can click on counties and start to combine some of that information. We're focusing on reopening as others are. When do we reopen parks? When do we reopen small businesses? Where we're going to be aligning with the governor's orders, of course, and then what decisions lie within county, our county government policies. Very focused on economic recovery, very concerned about the impact on individuals, businesses, and especially on county government. We've engaged Buxton to help us with data. The early and concerning data as a county that's relying on tourism is as of April 12th, there's been a 70% decrease in lodging on in our county and 34% decrease in restaurants. We're seeing some increases in behavioral health concerns. Our local hospital has seen an increase in overdose and alcohol issues. And I think as we move forward, we need to be very focused on this is going to have some long-term economic impact on our counties, and we need to be addressing the social determinants of health, things like housing, supportive housing, connecting people to resources, those. Some of our legislative asks, flexibility on things like the lodging tax so that we can use that funding to support local businesses and our tourism economy to come back online. An example of that is to suspend or waive for a while the 50-mile visitor rule, flexibility on deadlines of some of our deliverables, and project grants from the state. One of the focus of concerns that came up is our DD populations and our support of employment there. We saw over a 90% of those folks were laid off either due to the businesses or underlying healthcare conditions. So being able to relaunch supports to our DD population and that support of employment is important. Support for our behavioral health. Highlight for us was the importance of broadband for health, educational, and economic equity. We have large digital deserts throughout our county, and just trying to get our kids educated, remote workforce, all of that was a challenge for us. And I think that's it.
Hey, thank you very much. That was really thorough. I really appreciate it. Let's now take a few minutes to hear from, I think we're on Skagit County. We have, and you may need to unmute yourself, Skagit County. Do we have it? Oh, there we are. Yes, thank you.
Well, thank you very much for the chance to be able to do this. Skagit County, when COVID first came forward, we had all hands on deck. Our entire health department, emergency management departments have been working side by side, pulling people from other departments coming in to help with our command and control operation. Our court services have been very limited. We've increased our number of, the caseload will definitely increase, as mentioned earlier, once we come out of this, because of all the cases right now, they're being delayed. Skagit County has a Guimas Island Ferry. We stopped collecting fares during that time. We're looking at starting that up again with non-cash service here the next week or so, but that definitely will reflect in the amount of revenue coming in for our ferry operations. We're seeing an significant increase of expenses. Our health department is saying for the 10-month period, we will have over $4 million in a response effort on this program. So all these things are going to definitely affect us here in Skagit County. I think Commissioner Janicki has a couple other things.
Yes, good morning. This is Lisa Janicki. So, you know, on a high note or highlight, I think it's good to recognize that we all learned how to do business differently, given the social distancing, and some things I think will stick. The virtual inspections of certain phases of job sites was something we were able to do to bring certain projects to completion. And I think the innovation, I really appreciate the willingness of various departments to innovate. Someone earlier, or I think Janet or Commissioner St. Clair mentioned continuity of operation plans. We also found in Skagit County that there were very specific continuity of operation plans, you know, by department, but this view of a long extended plan given a pandemic was never really considered. So I think, you know, that's an area where I'm guessing that a number of counties will have to invest time and resources to really bring those plans up to date, including updating the teleworking possibilities and requirements. As we look forward as to, you know, where you know, coming out of this what might look like, I do want to underscore Commissioner St. Clair's comment about the mental health capacity. We've seen now what telemedicine can do. It's been forced to the front, particularly within the nursing home. I was on a senior services call yesterday with a number of the long-term care facilities, and the ability and the use of telemedicine, telehealth has increased in a good way. And I think we've got to acknowledge that that is going to continue to be an option. We need, the state really needs to take the lead on increasing our mental health capacity, and particularly, I think, making some, within the community and technical college system, making some, licenses, intermediate training certificates, licenses, whatever that looks like, available in near term, because the level, well, we've all seen it, the level of stress and the effect on families because of what is going on is real. And, even telemedicine with a mental health counselor, if you can't talk, would be a good step. And it's just such a big gap in what we have. I would ask the legislators to consider including county representation as the federal funding distributions come in. Federal funding comes in, the big cities get their direct distributions, and the other jurisdictions are going to be, waiting for the state to make decisions about how that money is to be distributed. I really think that both AWC and WASAC should have a place at that table to understand, what that looks like. And since that will be the source of some of these additional care things that the county services are having to provide. And then in our briefing this week, our coroner had noted that the overdose deaths were up, which of course, for those of you who know me, almost 3 years ago, my 30-year-old son died of an opiate overdose, and that becomes a highly sensitive issue for me. But if we're having that stress, there again, we go to the behavioral health side of things. So we just need to make sure we're funding that as well as we can at the local level. So I think I'll leave it at that. Kayla, you had maybe a wrap-up comment for us.
Hi there. Yeah, I just want to emphasize the lost revenue projections that we're estimating at this point. I think every county's in the same boat, but Skagit County is a heavily sales tax dependent county, with the city of Burlington being a high sales tax city. So we're estimating our 2020 sales tax loss could exceed $7 million, with no estimates yet on 2021 and 2022 impacts. So that's over half of our expected sales tax revenue that we expect to see go away. So obviously this funds a lot of our behavioral health and human services programs, and we're deeply concerned about sustaining those programs going forward.
Okay, thanks, Kayla. And after we hear from our fifth county, San Juan, we'll move on to talking a little bit more about what counties expect going forward, and hope to hear more about concerns people have about how do we move back into not just a healthy medical recovery, but also economic recovery as well. So now we'll turn the floor over to San Juan County. Thank you.
Thanks, Melanie. This is Jamie Stevens, San Juan County Council member. Here I am in my Zoom studio for the third week now. Once the governor's order came out, we immediately tried to stay home, stay safe as much as possible. So we have been working remotely. Council meetings have been held remotely. And I think as Mark Tompkins said, it has helped to dampen the amount of infections. I'm not going to go into a lot of our response because Mark did a really good job at the very beginning. At the beginning, we were focusing on health and safety, and then keeping people in their houses, keeping people fed, and mental health. And to a certain extent, we're still doing that. I'd like to echo what Dave Summers said, is that we we did have a run on food, which then put a stress on the food banks, and the restaurants being closed obviously stressed them. So 2 of our islands came up with a little bit different way of handling this through our family resource centers and food banks and churches. And they took the money that would have normally gone towards buying groceries because it wasn't safe to just have an open food bank, and contracted with the restaurants, who then contracted with the local farmers to create meals and then deliver those meals. So in addition to the school lunch program, they, like our normal seniors, used to be about 12 on my island, and they're now delivering meals to 60. And our resource center on Lopez that used to do about 120 clients now has 350. And they've been doing this pretty much on a daily basis through this whole thing. I am going to say something about going forward because it's been brought up a couple times. If we're going to be able to open up and we need reconnaissance teams and being able to check and do tracing, that's going to require people and resources that we're currently not knowing where that's going to come from. We are taking a giant financial hit, and as well as using so many people in our emergency operations. At some point, as Mark said, we have to get back to some sort of regular business. It's the Working Washington funds have been very helpful out here to our businesses. But on some of the other programs like the PPP loans, it's very disappointing. We're still trying to find out who, if anybody has gotten one in our county. I know it's a federal program and we have state legislators on the line, but that really passed over the real small businesses. I think as we're moving, as we are like everyone else trying to plan how to come out with that, and we hope that the governor and the state give some strong guidelines to us on both for our guidance for our tourists coming in and guidance for our businesses trying to reopen, as far as what are the safe practices as far as social distancing, etc. And also, by working remotely and having a severe lack of sales tax and other revenue sources, we are, as a council and managers, looking at really how we're doing business, level of service, and we've just begun those investigations to figure out what's going to have to be cut going forward. And with that, I'd like to pass it off to Council Chair Rick Hughes, who's on the line.
Great. Thank you, Mr. Stevens. And I'll make this really brief because we're probably getting close to our 5 minutes. Wanted to thank everyone here in this call. Really appreciate WASAC coming together with our state legislators. I think it's really important that you understand the work that we do. I think most of us on this call at the county level and staff members, we're probably working 10, 12 hours a day. We get up and have 4 Zoom calls and then have emails to catch. And it's funny, you take a break for lunch and all of a sudden you're 3 hours behind on emails. So, there's some interesting things that we've had to deal with that I never thought I would. For example, we've already pre-written our public statement for the first death, which is kind of a sad thing, but it's a new norm, and you really wake up every day not knowing what it's going to be. We're also in a strange position. I think Mark alluded to this a little bit earlier, but we are a tourist and construction economy, and we've basically tried to pull the drawbridge up and say no one come here. We've extended the governor's order by putting a freeze on all short-term rentals. We've put signage up, as Mark mentioned, in all the ferries, and we're now currently doing an ad campaign across most of Seattle and Bellingham asking people to stay put, which for our community is a really difficult thing to do. But just understand we're walking away potentially for 30 to 50% of the revenue we have in sales tax to keep our community safe. So one of the things that we can ask for going forward is to have the state really take a serious look at regulatory relief when may it come to implementation of the GMA. I mean, we're behind in our comprehensive plan, but we can't even think about that because we need to have all of our staff that's able to work focusing on getting permits out. So when we can flip the switch on again, that people can get to work. How can you work with us to find a strategy moving forward that takes a new look at some things. We've had to set up with the Commerce Grant money some, I wouldn't say encampments, but individual places for homeless folks to stay in place, which might be in violation of some of our GMA rules. So I really think we have an opportunity to take advantage of this situation to have real positive outcomes. And then I can only emphasize, and I think Mr. Stevens said this, is that everything we do going forward, county needs to be at the table. Whatever piece of legislation, may it be GMA improvements or recovery efforts, there needs to either be WASAC or county representation from both big and small counties. So thank you very much. Only thing I can say is more emergency rental assistance would be great.
Thank you, Council Member. Let's go ahead and move on now. And some of you have already covered part of it. So hopefully we can condense this second section into a little bit shorter, because I do want to make sure we have ample time for any questions that we might have on the phone. So let's actually start with Mitch, if you could move forward to slide, I think it's 15, the looking ahead. There we go. Thank you very much. Let's start with Skagit County and hear from you regarding what needs you anticipate moving forward.
Yeah, this is Commissioner Ron Weason again. Can you hear me?
Yes, sir. Thank you.
One thing, as I mentioned before, our court have not been operating very well, and one of the issues we do have is when we're able to resume jury trials, we don't have jury rooms that have adequate social distancing, and so one of the things, what type of facilities and so forth are we going to have to need to make those trials and so forth go forward in the future. Additional funding from public health response, as mentioned from other counties, including disease investigation, track tracing, data management. The other issue for the homeless, we've got about 45 high-risk homeless with motel vouchers right now, and those vouchers are going to run out by May 4th, and that is a very vulnerable population, so we're going to need increased funding before we move forward, because those homeless just don't have any place to go. And so those are some of the things that we see immediately coming out of this, but as mentioned by everybody else, the different budget constraints and how we do the new normal of county staffing and what type of services or level of services we can afford to have for our public. And as all this stuff has kind of slowed down, we just haven't had the public come in, but we expect when we open up, there'll be a lot more traffic from the public, and so we'll have a lot of catching up to do, as mentioned by some of the other counties. Lisa, you have some other things?
No, I think I covered most of it in my earlier comments, so I'll pass.
Super, thank you very much. Let's go on now back to San Juan County and see if you have anything else that you haven't covered yet that you would like to talk about in terms of moving forward.
This is Jamie Stevens. I think I covered most of it. I think it's really important that that we do get some planning. We have been a county also who's been wanting to open up some of our recreation areas and also to get working on construction. We currently have a large, for us, affordable housing project being built. The contractors are coming from the mainland, and it's just a little hypocritical to have those contractors working while our contractors in our county are sitting on their hands. So I think with some good guidelines that we could turn that dial up and get it moving. Thank you.
Thanks, Commissioner. Council member, sorry.
Could I add one final thing as well?
Yes, please, sir.
I'm on the, of course, I can't go to a meeting without talking about ferries, so I'm going to talk about ferries for a second.
You couldn't.
I promise you I'd do this. So, you know, here we are trying to tell ferries and everyone else in the world, and we're spending general fund money to advertise to tell people not to come, while at the same time demanding the same level of ferry service that we have from Washington State Ferries. And we're currently on a reduced, revised winter schedule. And I guess going forward, all I can ask is that for everyone in the room, Washington State Ferries is our bridges, our highways, there are toll booths. It's everything that we need to get to have our community exist. And so when we do come out of this, Ferries is underfunded, has been traditionally underfunded, and now when they've lost 70–80% of their operations revenue, we need to find a way to keep ferries going. It is the only way our community can survive. So my plea is, don't forget about Washington State Ferries, and it's not a luxury boat. It is our mainland access vehicle.
Thank you, Council Member. How about we move on to Whatcom County? And we were never able to make the audio work properly, unfortunately, for Executive Sidhu. So let's see if we have some council members who are available,
This
or
is
other people from the county who can speak.
Councilmember Donovan's on the phone. I can start, and I think Councilmember Brown is still here too.
Thank you.
Sorry, we're missing Mr. Sidhu. I'll get at the third bullet point there, in terms of impacts on county budget staffing and stuff. And I was just reading a memo Mr. Sidhu sent us yesterday. We're implementing a selective hiring freeze, trying to control spending, reducing purchasing with a goal of about 10%. But one of the biggest uncertainties is, well, we also just got a note a few minutes ago from our treasurer, because we did do a property tax delay, but those are coming in, he says, basically normal. So the big uncertainty in terms of answering, what do we foresee as a county budget, is projecting what those sales tax revenue losses are going to be. And our discussion yesterday had that at 75%, so it's not as bad as maybe we're hearing from some of these other counties. But if we could get more assistance from OFAM or anybody to try to come up with, like, how do we really project what sales tax revenues are going to be? But that's where we're working off of right now. We're kind of moving our unified command structure, is being rearranged a bit today to have a single incident commander. And it is, I think I heard this from some of the other counties, moving more towards planning for economic recovery. But again, I don't want to speak for the executive. I'll pass off to Mr. Brown here if he has something more to add.
Yeah, so hi again. We're, of course, obviously a border community, so that's had a big impact because we've gone from, I think it was 150 vehicles a week, 150,000 vehicles a week to 2,000 total, and that's basically healthcare workers. So obviously that's affected multiple things. For example, Blaine's biggest taxpayer is actually Amazon, for Canadians coming down across the border and picking up packages, sales taxpayer. We're going to have to work out what we can do that from a seasonal perspective. The industries that are obviously most affected are ag and construction and tourism. The ag business obviously only has about a 3 to 5 months window to do its work. Construction, of course, is dependent on the weather. We've cancelled large events which usually bring a lot of tourist traffic across the border. Those, I just don't know how we do that this year. And then again, I think it's back to the dialogue of what do we do collectively in terms of the economic recovery. I'll finish with that.
Thank you, Council Member. Do we have anyone else? I think that's everyone there, but just double checking before we move back to Snohomish County and Executive Summers.
Will Island County get a chance to speak?
Absolutely. You're next on the list.
Okay.
Okay, just want to echo what some of the others have said. Our general fund is about half driven by sales tax. And so we're expecting significant, we've done a county department-wide hiring freeze, so we're expecting significant impacts this year. And about 77% of our general fund is criminal justice expenses, so it's going to cut into all aspects of county government. As we move forward, it's quite clear that all the plans for starting up businesses or returning to some new normal depend on having adequate test kits, having contact tracing measures in place, availability of PPE for people, continued quarantine and isolation sites, which will be our responsibility. We've got to figure out sanitation supplies, and social distancing. So there's a lot of things that will have to be carried forward in the future as we reopen. And we've got, for example, we've got outstanding requests to the state for Snohomish County healthcare providers and ourselves for about 786,000 surgical masks, 600,000 procedure masks, 254,000 N95 respirators, 265,000 N95 large respirators, 60,000 disposable gowns, and 88,000 COVID-19 test kits. And so those are outstanding, have been for close to a month now. And that need will only grow as we go into the future. One thing, we've started up an economic recovery task force, which will bring in our businesses to generate ideas of things that would be helpful, whether it's ordinance changes or permit extension times, that sort of thing. The Boeing facility at Everett did start operation again on Monday. They've put in significant protections for the workers, include everybody's wearing masks, gloves, their social distancing requirements, their common spaces are closed, they are sanitizing workspaces. So that'll be a useful model to see if in the next 2 or 3 weeks, if they're successful there, that they might provide sort of a template for how we can implement those types of measures for other businesses and start things back up again. So that's the approach we're taking, is, and we're glad Boeing's up and running and hopefully will be successful, so we can again use those lessons to start things back up again. But we've got a lot significant expenses out into the future to maintain some of these measures that we just don't know how we're going to cover. It's one thing to stand up a quarantine site, it's another to staff it. It's very expensive. Our Angel of the Winds facility is costing about $750,000 a month. So, and it's still unclear what, we are a CARE Act county, but it's unclear what those dollars are going to be used for and how broadly and how adequate they will be. But so looking forward to a lot of financial needs, but also flexibility and regulations and time frames, and some, I think, common standards that we can all work with in getting our businesses stood up. I think the more that we're together and have a common message and approach, the better. So I'll leave it at that.
Thank you very much. Really appreciate it. And last but certainly not least, before we move on to our question and answer period, Island County, would you please let us know what you anticipate going forward?
Commissioner St. Clair, can I jump in here real quick?
I would welcome you to do so, Wanda, and I'd also note that Commissioner Price Johnson is now on the line.
Great. So I just wanted to bring up something I did not hear addressed previously. Of course, being the treasurer, the making sure that we have sufficient cash to meet our needs is my responsibility. Island County is very dependent on sales tax revenue. Since our businesses, the car places on the north end moved up to Skagit County, we're also dependent on the rural sales tax that we get as a distribution from the state. It alarmed me that the filing date has been pushed back for businesses restarting that have collected sales tax on their sales. Their filing date's been pushed back, and the payment date for their tax, as far as the state is concerned. I believe that was one of the governor's declarations. I also saw something recently, and I think it was in a legislative newsletter, that there's a consideration that the state government may extend the deadline for filing and remittance of the sales tax revenues collected another 6 to 12 months, which would really hurt counties that are relying on that sales tax. So I just wanted to make that point. I will now pass it to our commissioners. Thank you.
Commissioner Price Johnson, do you want to respond?
Janet, I was going to let you take the lead because I just hopped on, so I don't know what's already been covered.
Okay. So I'll just mention a couple of piggyback on the concerns about the surge in caseloads and other court-related issues, concern about drug court and the importance of that in maintaining our healthy communities. We are beginning to anticipate concerns, the economic concerns around layoffs. Boeing is a large employer for Island County. A lot of our residents go off island. So we're looking to carefully assess what's happening at Boeing, as well as the county is also a large employer. And so the stronger we are as a county to sustain operations, to be as strategic as possible, is our ability to keep folks employed and keep the economy flowing. I've already spoken about the tourism issues, and Representative Paulette asked a good question about when you ask about some of the concerns coming forward. As we look forward and we anticipate that this isn't over, that dialing it back, we may see this second wave. I think if the Department of Commerce grants can be continued for support of our isolation centers, others have spoken about that. Those, to my knowledge, end in September. Costs about $300 a day for us to support just one individual in isolation. So we need to maintain the resources we have to currently respond to this pandemic going forward as well. So that's testing, PPE, all the same things we're paying attention to now. We need those going forward from a public health perspective, and then attending to the economic impact is two of our key focuses. I'll stop there.
Great, thank you very much. Well, we managed to be really close to on time, and so I appreciate your brevity, all of you, in what is a topic that's almost impossible to be brief on. So we can move into questions now. I'm going to look in the chat box and I'll read those, and then we will open the dialogue to just if anybody has a question they want to ask out loud. I will start with the most recent one and work my way backwards. Can you ask the health professionals on the call, do the contact tracers have to be public health / nursing staff, or can they be volunteers, minimum wage workers who've been furloughed, college students, retired professionals, etc.? Do we have our health professionals still on the line, or Jamie, if they're not, maybe you can answer?
Yeah, so this is Mark Tompkins.
Go ahead, Mark.
And Sean, you can fill in as well. So it's an excellent question. As I've stated, we have brought in former retired public health nurses and also our environmental health staff. I think that there are additional folks within the workforce that you could potentially tap. It comes into a question of training and actually having a good training model and having a script for them to use. There are technical questions that come up periodically, and having that nurse available to answer those is really important. So I think it could be a combination of different types of workers that can fill that need, and we certainly look for ways to do it in the most efficient and effective way possible. And so I don't know if you have anything further to add, Sean.
No, I think you kind of nailed it. And similarly, we're using Medical Reserve Corps volunteers, which are primarily people that are retired nurses and doctors. We are using some members of our environmental health staff. We've actually moved, we have hired a few temporary positions that are specifically doing work in between case investigations and doing some of our work in the long-term care facilities. But it really does come down to, it's not so much the academic skill set, whether or not someone's a doctor or a nurse or a skilled public health worker, but it really does require that level of training to be able to collect all of the pertinent pieces of data. And in some cases, these are very challenging conversations where someone may be speaking to the family members of a positive case who was recently deceased and may still be in that that grieving stage where we still have to have that conversation around identifying contacts and doing that investigation process. So while there isn't really a specific need, there are definitely some training items that we need to make sure are in place for that process to be successful.
Great, thank you. Moving on, I will say that Representative Paulette says, thank you for sharing the isolation costs, and that he would appreciate it if others would share their costs with us, and we will pass it on. And absolutely, if there are any questions here that are data specific that we can collect, we will most definitely do that. No problem at all. He also tells us that there is or may be a legislative proposal to have contact tracers be long-term training course with nursing, public health and social workers, students, as well as people who speak languages in impacted communities, and so on. And that actually is in there to everyone, so you can see it. So thank you, that's great. We're very happy that people are looking into it, and we are very happy to help you in any way that we can. Liz Lovelet says, so glad to work with the amazing county council members in the 40th, San Juan, Skagit, and Whatcom. You're doing a tremendous job, so that's terrific. Thank you very much. Scrolling up through just some okay, that looks like more data questions that we will get back to you. There was a question about data broken down by race, and I would ask maybe Jamie to jump in here as well. My understanding, just from reading something, and I can't even remember what it was that you have to have a population sample large enough that when you say a person's race, it doesn't identify the person. So in really small communities, it's a lot more difficult to do in the larger communities. Or if you have, say, only one person of a specific race who is sick, then when you identify the race, then it's easier to identify that person. So I think there are some challenges there, but I know it's being worked on. And if any of the public health people or Jamie want to chime in on that, I think we're all interested in what's happening there.
Yeah, I'll jump in quick, and then I'll let Sean and Mark touch on this as well. I think there is absolutely a desire to have a more robust data for a lot of our positive cases. You know, we're hearing a lot about disparities and inequities on how COVID is spreading throughout our different communities. I think it really varies greatly county to county about their ability to be able to break this down. I know for some jurisdictions, they have the capacity to get pretty prescriptive on how they could report data, and others just don't have that capacity right now. And we absolutely want to be able to have all of our jurisdictions have that capacity in the future. It's just not a reality right now. And also, I think we need to be aware of the number of cases that we have per jurisdiction as well, and wanting to make sure that we're respecting the privacy as much as possible for those individuals who are recovering from COVID, so that we don't disclose more information that's needed. So there's a balance there of making sure we have the infrastructure and capacity to have very robust data, as well as balancing that with the privacy protections of individuals who are impacted.
Thanks, Jamie. Anyone else want to weigh in on that one?
I think Jamie covered it very well, and from a small jurisdiction, for us, it is both a capacity issue, but it's also the small number issue that we have. And with only 13 cases, if you start breaking it out by race, ethnicity, age, you pretty soon you can quickly identify folks, and we just can't do that. And so you can look at it as a regional basis. You can lump some counties together, but trying to do it from small county, small number perspectives can be very challenging, and it really doesn't work.
Thank you. We have one more comment in the chat box that I will mention, that is from Councilmember Brown, who says there's an opportunity to save money and increase response if we can build a common online training / certification platform for contact tracers. Good persons capable of difficult conversations could be mature members of Rotary, LWV, Assistance League, Lions, etc. I think the idea of a common platform is a great idea. So hopefully that's something that we can consider too. And Councilmember, I see you're unmuted. Would you have something you'd like to add?
Yeah, I think there's plenty of platforms out there for doing online training. If we can get together certain health officials to do the to build the work, and then the benefit is if we work collaboratively. If there's an outbreak in one county, but there's other counties where things are a bit quiet, we can share resources across those boundaries. LWV should be League of Women Voters, by the way. So,
I assumed so, but I didn't want to say it just in case I was wrong.
but there are a lot of mature, responsible, intelligent people who are housebound, who are looking for an opportunity to serve, and I think we should take advantage of their desire.
Thank you. So that's really all the questions we have in the chat box right now. We can open it up for oral questions, and you can raise your hand by clicking, there's a little hand button on here someplace, and you can, if you're on the phone, you can hit *9. And Mitch, I don't know if I can see those, so if you can, I would appreciate that. So far I don't see anybody, but I might not be the best person to be looking. So do we have any questions anybody would like to ask?
Right now, only Keith Wagner has his hand up.
Okay, let's go ahead and unmute him so he can ask his question.
Hi, Melanie. My question has to do with the isolation beds, and maybe it's for Sean Frederick or Executive Summers. They talked about that 150-bed isolation facility. I'm wondering how much utilization that got. So do we need a bigger facility, smaller facility? Just if you can give us an idea of how the utilization was on those.
Jamie, go ahead and jump in, or whoever wants to take it, feel free to just jump in and answer.
This is Sean Frederick. Right now, the census in the facility is pretty light. Because of when it was stood up and where we were in our curve in Snohomish County, there hasn't been the overwhelming demand. So without knowing the specifics on where your jurisdiction is, it might be hard to judge. But I can say that our census so far has been pretty low.
Thank you. Appreciate it.
Anybody else on that one, or any other questions that we have? While we're waiting for people to chime in, I will say that Helen Price Johnson has a good point in the chat box. She says that economic recovery will be inconsistent across our region, and being sure that the state responses provide flexibility is important. For example, over 90% of Island County businesses have fewer than 10 employees, and that's a great point. Thank you. Questions from anyone else? Please don't be shy. We have time. Or maybe we've done such a good job, you just don't have any.
Melanie, perhaps if I could expand on Representative Wagner's question a little bit more.
Definitely, please do.
So I think this is important, and this is the nuance of our statewide data picture versus our individual jurisdictional data picture. Pockets that are happening differently across our state might be utilizing those isolation quarantine facilities a little bit different. I know Clark County, for example, is working on ramping up that effort, and they're a little bit their case count and picture of the outbreak is a little bit different than what's happening in the north part of the Sound, likewise in some of our pockets in eastern Washington. And so I think isolation and quarantine discussions kind of started happening around the same time for everybody, but you're seeing them being utilized a little bit differently. And if you're interested in getting more information on kind of a regional perspective, I can certainly gather that information and share that out. I know Representative Paulette would be interested in that information as well.
Thank you, Jamie. And while we're wrapping up and seeing if anybody else has any questions, I also just want to let you know what WASAC as an association has been doing. We've really taken on the role of making sure we are providing as much current and easy to understand, etc., information that we can out to our members. So we've been trying to synthesize the just massive quantities of information that comes in every day and pass it on to people in a digestible manner. We are also trying to make sure we are hearing from our members and affiliate members on a regular basis about questions they have that we can find answers to, issues that they are dealing with. And to that effect, we have been having, it must be 10 to 12 calls and webinars a week where we have a standing call with our local solid waste managers, our planners, our county engineers, our county commissioners and council members, our IT folks, our administrators, ACHS, etc. So if you have any questions specifically about how any department within a county is handling things, please don't hesitate to email us or give us a call, give me a call, and we can track down specific information for you. It's really been fascinating to hear how different some of the counties are in terms of their reactions, just simply by virtue of their size or what kind of technology they have available. And it's not necessarily specific to the communities who are on this call, but I can give you a couple examples that resonated with me. For example, one county had to rush out and buy a bunch of laptops from Costco because they didn't have laptops, they had desktops, and they needed to be able to continue county business while social distancing. And that was the way they had to make it happen, because they had to make it happen fast. Other communities have had concerns about how do you get important documents to the county when you are not in personal contact. And in our phone calls, one of the counties said, well, we've repurposed our ballot drop box and we are having important papers and payments and whatnot put in that secure facility location. And that's a great idea that other people are doing. And so there's a lot of just simple things that can be done to make life easier. And then there's a lot of complex questions that people are sharing information on, such as how to handle your employees with the various different kinds of leave and the more complicated garbage pickups or drop-offs, or just all kinds of just a myriad amount of issues that you wouldn't necessarily think of, that everyone has had to think of in real minute detail. And so if you are interested in that kind of information, don't hesitate to ask. And if there's any data we can provide you, etc., we are definitely here to do that. So if there are, I think it is 12:30 now, so I don't want to take up any more of your time, but we will send you out the slide deck. We will send you out a copy of the presentation, and we will summarize the comments on this call, as well as at the end of all of the calls, we will summarize the overarching themes that we've heard from them, and we will provide that as well. Don't hesitate to sign up for more than one of these calls if you're
Good.
interested. We do have people who have done that,
Just
and you're
finishing up
more
the
than
WASDAQ
welcome.
call.
So please feel free. Jamie, do you have any last words before we let everyone go to their lunch break?
I would just, again, thank you to our speakers, Sean and Mark. My thanks as always. Thank you to our attendees and our participants in allowing us the opportunity to, have this discussion with you. Very valuable, and it wouldn't be a public health call if I didn't end with stay home, stay healthy, wash your hands.
Well, I feel like we should end on that note, but I don't want to, because I wanted to say that it has been very apparent that we all thought post-legislative session we would slow down, and that for us has not happened at all. We've stayed incredibly busy, and I know that's the case for all of you as well. So legislators, council members, commissioners, executives, lobbyists, association heads, etc. Thank you so much for your time, and thank you so much for all of your hard work, and for really being a source of inspiration in some gloomy times. If we didn't have good leadership like you, I think we would feel much gloomier. So thank you very much, and have a terrific day. We really appreciate all of you. Bye-bye.